Hi there. I'm glad everybody's getting on here tonight, and we're going to talk a little bit about Medicare and what your options are. Before we get to that point, what I want to do is talk to you a little bit about who I am. My name is Michael Hixson. I'm an independent agent. That means that I can shop plans for you and try to find what best fits your needs. Let me share my screen with you. That way you can see my PowerPoint presentation. All right, here we go. All right, got you started up on that. And handsome little fellow over there, picture. That's my agency, Empower Seniors. And for those folks that stay to the end of this presentation, I've got a link at the end of this that's going to be able to give you some free videos. It's a Medicare series videos. It goes from what to do, how to enroll in Medicare. It also talks about original Medicare. So I've broken it down a little bit. It's going to cover a lot of, we're going to cover a lot of the stuff here today that's in those videos. But if you need to kind of take those videos with you and watch them over and kind of get an idea of what to do, they're going to be there for you. Just stay till the end of the video and the workshop, and I'm going to give that to you. Just kind of give you a little overview of myself. I've been helping folks with Medicare since 2010. I used to teach high school science, but as of 2010, I've been helping folks with their Medicare. So I've got a different set of students now, and educating is what I like to do, and I like to explain things and help you understand. If you have any questions, just type them in, and my assistant will be able to answer some of those questions for you. And as we go, so just type them in the comments. And okay, here is also my phone number and my email address. My agency is Empower Seniors, and I do live in the Oklahoma City area, metro area, but I service folks in Arkansas, Oklahoma, and Texas. So I'm licensed in all three states, and I can help you with that. And of course, if you ever call in, you're going to get me or one of my assistants, and you'll be talking to a human and someone who actually can speak English, even though I do have a little bit of a Southern twang. All right, let's look at the next slide. And there we go. I do need to do a little disclaimer here. In this presentation, I'm not selling any specific products. Our purpose is to educate the general public on a general basis or class of products. I'm not going to get into specific plans or anything like that. That's something that we would need to do one-on-one because everybody has different needs. Anyway, if you are interested in specific information about specific products, we'll be happy to provide you with the insurance company created product information approved by the Department of Insurance in your state. So we'll be able to help you with that. And we can do that. And of course, we could do Zoom videos so you can see exactly what I'm talking about and do that. Okay, the next slide. Here's what we're going to cover tonight. We're going to talk about when do I enroll in Original Medicare? What is Original Medicare? What does Original Medicare cover and not cover? How do I cover most of the cover costs that's not covered by Original Medicare? And you got two different ways to cover those costs that Original Medicare doesn't cover. You got Medicare supplements, you got Medicare Advantage plans. Now we're going to talk about the differences between the two of them. What are the stages of the standard drug coverage? Now it changed for 2025. So we've had a big change for this year, and I'm going to cover that. What should you look for in an agent? And then what are your next steps? So those are the things we're going to cover in this webinar today. And like I said, if you have questions, just text those in the chat box, and one of my assistants will help you with answering those. They'll answer the questions for you. Okay. All right. Now, we know that Medicare is confusing because they talk about a lot of different jargon. They have what is a plan, what is a part, what is a Medicare Advantage, what's a PDP, long-term care, supplements, so all of that stuff. And what I'm going to do is I'm going to try to, by the time we're done, we're going to sort all that out and make it not as complicated or not as confusing, because I'm going to break it all down. Next thing we're going to do is we're going to talk about your enrollment period. So when can we enroll in Medicare? So we're going to talk about your initial enrollment coverage. Okay, so your initial coverage, or when you can initially get Medicare, and this is a calendar here, you get 3 months before your birth month, the month of your birth, and then 3 months after your birth to enroll in Medicare for your Part B. Now, understand that if you do not enroll in Medicare when you have the availability to do it, and you don't have credible insurance or credible coverage where you work or something like that, and you decide to do it after your initial coverage starts, then you're going to be assessed a penalty. And it can get pretty expensive with your Part B and your Part D for your drugs. So let's talk about your initial enrollment coverage or enrollment period. And like I said, it's 3 months before your birth month, the month of your birth, and then the 3 months after that. So you have actually 7 months that you can enroll in Medicare before you turn 65. So you have those 6, and then there's no penalty in that time frame. So how do you enroll in Medicare? What are the ways that you can actually do that? Well, let's look at this next slide. In this next slide, you have 3 different ways that you can enroll in Medicare. You can call in on the 800 Medicare line. You can get on the phone and call them. You can visit your local Social Security office, but we all know that takes a lot of time. You can also create your My Social Security account at www.ssa.gov. You can create your account there and do it online. I do offer assistance with that. If you need some help with it, I can help you create your account and then help you with applying for your Medicare if you need that assistance. Okay, we're going to talk about Original Medicare. What is Original Medicare? Well, Original Medicare started in 1965, and it broke it up into inpatient hospital care, which is Part A, and outpatient hospital care, which is your doctors, your Part B. It's basically anything that's out of the hospital. So you got inpatient, outpatient. So Part A, inpatient, Part B, outpatient. And you see how it says part. Anytime you see part, it's going to be talking about Medicare. If you see plan, that's going to talk about Medicare supplements, or it could even talk about Medicare Advantage plans. So keep that distinction in your mind when you're talking about a part versus a plan. Next thing, then we're going to talk about what's not covered by Part A or Part B. Well, with Part A, you have deductibles and you have co-insurances and you have premiums. And we're going to talk about those. We're going to go over each one of these individually. For Part B, you have excess charges. That's the amount that's allowed billed over what Medicare agrees to pay. You also have prescription drug coverages that you need to add. And the big 4 that Medicare doesn't cover is dental, vision, hearing, and long-term care. So those are the big 4 that it doesn't cover. And of course, like I said, it doesn't cover deductibles, co-insurance, premiums, the excess fees. So those are the things that Original Medicare does not cover. And of course, drug plans. So you have to have a drug plan. Let's look at the next slide. We're going to talk about Part A, a little more in depth. This is what Part A covers. Part A, like I said, it's inpatient care. So that's hospital. That's mental health, skilled nursing, hospice. It also covers some of your blood transfusions. Now, what's the cost of Part A? So let's look at the next slide and go over the cost. If you didn't work 10 years, which is 40 quarters, and pay into Social Security, If you did not pay that tax, then you may have to pay a premium. And that premium could be as high as $518 a month. Now, for all you folks that work more than 10 years or 10 years or more of your life, you have a zero premium. Now let's look at what your deductibles are and what your copays are for Part A. This is when you're admitted into the hospital. You're confined to the hospital. So you have a deductible that in 2025 is $1,676, and that's what you pay day one when you're admitted into the hospital. And that's for days 1 through 60. So days 1 through 60, you have a deductible, you pay that. And if you stay longer than 60 days, day 61, you have a per day copayment of $419 each day. So from day 61 to days 90, every day you're in the hospital, you pay an additional $419. Well, let's look and see if you are really sick and you stay in more than 90 days. On day 91, that copay goes up to $838 each day, all the way up to days 150. So once you get to 150 days, it stops paying and you have to pay all the cost over 150 days in the hospital. Skilled nursing. Skilled nursing, sometimes people are transferred from the hospital to skilled nursing. In the first 20 days of the skilled nursing, there's no copay, so it's zero. But keep in mind, and this is something you really need to keep in mind, is that it will only be covered if you spent 3 days in the hospital first. So if you've been in the hospital for 3 days and you're transferred to skilled nursing, then it will be covered. And the days 1 through 20, you'd have a zero copay. Now, day 21, you start having copays every day of $209.50. Let's look at an example of when you're in the hospital for 95 days. This is what your bill would be if you were in the hospital for 95 days. Well, the first day, up to day 60, you're going to pay $1,676. That's your deductible. On day 61, you start paying a copay of $419, and that's for the next 30 days. Well, that adds up to $12,570. Well, that gets you up to day 90. So day 91 through 95, you pay a copay of $838. So you multiply that times 5, that comes up to $6,704. Add all that up, it's almost $21,000 just for those days in the hospital. This is why people want to get some extra coverage, because it exposes you to a lot of liability. Well, the way to do that is to either take out a Medicare Advantage plan or a Medicare Supplement plan. We're going to talk about those in a few minutes after we talk about Part B. So let's look at your Part B real quick. This is what Part B covers. Part B covers your physician. Everything is outpatient. You may have a shoulder surgery. You go in and you go to an ambulatory service. They do the surgery. You're in and out that one day. Well, that's outpatient. Now, that could be a pretty substantial cost, because with Part B, you're going to have to pay, and I'm going to go over the cost of this in just a second. I'm going to go over the premium. I'm going to go over what the copays are and the deductibles. We're going to cover those. So let's finish off what Part B does cover. It covers your physician services. It covers all the outpatient hospital services, ambulance. One thing I don't have listed here, that's emergency room, outpatient mental health, lab services, durable medical equipment. Also, if you have diabetes, it'll cover your lances and your test strips. That's all durable medical equipment. Outpatient physical, occupational speech therapy, those, and some preventative care like your cancer screenings. Let's look at the premium for your Part B. Most people are going to pay a standard premium That standard premium is this year for 2025 is $185. Now that's standard premium. If you look there, we have individual income, we have joint income, and then we have the monthly premium. If you're an individual and you make more than $106,000, then you're gonna, if you make between $106,000 and $133,000, then you're gonna pay a premium on your Part B of $259. Everybody can look at that. There is also an annual deductible of $257. So that annual deductible is something that you're going to have to pay before Part B or before it pays anything. So you pay your deductible, you pay your premium every month, you pay your deductible. Once you've paid your deductible, then Medicare is going to kick in and it's going to pay 80%. So that means that you are going to have to pay the remainder of 20%. Let's get back to that shoulder surgery. Well, if shoulder surgery cost you $20,000 and you're in the hospital, well, you're in and out. It's considered an outpatient process. You're in there in the morning and then you're out that afternoon, then that's going to be covered under Part B. And it's not unusual to be cost about $20,000 for something like that. Well, $20,000, 20%, that's going to be $4,000 for that. So you see, with just having original Medicare, it's just not enough. You've got to have additional insurance coverage to cover that risk that original Medicare doesn't cover. And you have two options. You have well, let's look at these. Let's look at these. Here you go. Here's your options. You can have retirement group coverage. If you stay with, if you're with a union or something like that, they may offer a group plan. That might be the best solution for you. It doesn't hurt to go ahead and compare it with what you can get in the independent market. Because I know here in Oklahoma, if you have like Health Choice, which is a state program for teachers, then I can save you money because the state union, state coverage is it's expensive. I don't know why, but usually I can save you probably about $125 a month with an individual plan. Medicare supplement plans, that's in the individual market. And plans, there's A through N. So we'll talk about those in a little bit. Medicare Advantage is another solution. Or of course, you can have Medicaid, which is a state program with Medicare. And you can also, if you have Medicare or Medicaid, that would qualify you for what's called a special needs plan for Advantage plan. And you can also have that. So basically you have Medicare supplements or group, Medicare Advantage plans, and I can help you with either one of those. And if you notice there with Medicare Advantage plans, you have mostly just HMOs and PPOs. Those are the most common types. They mean that you have a network. PPO means that HMO means that you have to stay in the network. If you go outside the network, then you're going to be responsible for 100% of the cost. Your Medicare Advantage plan won't pick up any of the coverage or cost of that. If you're in a PPO, you can go outside of the network and get coverage. It just costs you more money. So it gives you a little bit more freedom, but not as, it gives you more freedom than an HMO. But if you want a lot of freedom and you want to know what your budget's going to be like, a Medicare supplement plan is going to give you more freedom because there's not any networks. You can go to any doctor that accepts Medicare throughout the United States. And of course, you pay for that because you're going to pay an additional premium each month for that Medicare supplement plan. Most of the Medicare Advantage plans are basically a pay as you go, whereas Medicare supplements, you're prepaying your Medicare or medical cost. So let's look at Medicare supplements. Let's look at we're going to kind of do a comparison here. Medicare, these are the two we're going to talk about, and I'm going to talk about Medicare supplements first. Medicare supplement plans, they are standardized with Centers of Medicare and Medicaid, meaning a plan in is a plan in. It doesn't matter who you get the plan in through, it's defined as a plan. So what you want to look for in the company is how strong is the company, what's their customer service like, those type of things. Medicare Advantage, those are also very regulated, and they are very regulated by the Centers of Medicare and Medicaid. The things that change, differences between all of them, now it's getting to where most of them are very, very close with what they offer. There's a little bit of changes with the networks and the deductibles and copays and things like that. So let's talk a little bit more about Medicare supplements first. Okay, Medicare supplements. There are more than 32 different companies that offer the exact same federally standardized Medigap plans A through N. The most comprehensive that is available right now for people born after January the 1st, 2020 is a Plan G. And we'll look at it a little bit more. Next slide is a kind of a picture of a lot of the different companies that offer Medicare supplements. These are just a few of them. It's not all of them. And there's more actually coming in now than there was when I put this one together. So there are even more companies out there than what I have listed. Like I was saying before, Medigap plans are offered by an insurance company under strict guidelines. These Medicare supplement plans, Plan F is not available anymore as of January 1st of 2020. So that one's not offered. But you can get, well, it was actually Plan F and Plan C that was discontinued. So those two were discontinued in 2020, January 1st. Here are the plans. Like I was saying, Plan G, you see those little red spots? Well, those red spots, those indicate what is not covered by those plans. If you look at G, there's only one of them that has a red spot. And what Plan G does not cover is the Part B annual deductible. Now, what was that annual deductible again? That was $257 for this year, for 2025. So it doesn't cover that, but it covers everything else. So when you purchase a Plan G, you just know that everything, once you pay your premium and you pay your Medicare premium, you pay your supplement premium, then it's going to, and you pay your Part B deductible, then all your medical coverage from Part A hospital and outpatient that Medicare covers, your supplement is going to pay the balance. Now, it has to be covered by original Medicare before your supplement will cover it. Obviously, you can't go out there and get plastic surgery or cosmetic surgery and expect your Medicare supplement to pay it when Medicare doesn't cover it, because it only covers what original Medicare covers, and it covers the balance of what Medicare didn't pay of that covered item. Plan G is a good plan. That's a common one. Plan N is also a common one that people look for. So knowing that, I mean, why would you need an agent to help you? Well, I'll tell you why. An agent like myself, I can help you with navigating through the different companies that offer these plans, the ones that have they have more of a stable rate increase, because all of them are going to increase their rating, their premiums. And if you have a stable premium increase, you want to keep that lower. And I can kind of help you with knowing which ones are the ones that are are very solid companies. They have financial stability. They have good customer service, all of those things. And I can shop it for you, which is a lot faster for you because it takes all that work and headache off of your mind. Let's look at the next one. We're going to talk about Medicare Advantage. Medicare Advantage, I am licensed in Arkansas, Oklahoma, and Texas, so I work in the 3 states. Disclaimer, we do not offer every plan available in your area. So if you want to know more, but more of those plans, you have to go to medicare.gov or call into 800 Medicare or your state health insurance program, your SHIP, to get that information on all of your options. But I'm going to let you know I do have contracts and certification with the major carriers in each one of these states. So I can help you with what you really want to look for with Medicare Advantage is you want to look for the companies that have the largest networks, the ones that have the best customer service, because you want to have somebody that doesn't disqualify or reject claims, because you don't want to have to keep fighting them. So I deal with companies that have at least a 3.5 star rating. I won't go 3 or lower because 3 is just average. You want to have above average on their star rating. Star rating goes from 1 to 5. 5 is the best, 3 is average. So I want to look at companies that have a little higher than average star rating. Now, there are companies that bring in new plans for that year, and it does take them a couple years to get a star rating. But if you're looking at the company and you see their overall star ratings with their other plans, and all of them have high star ratings, I would feel comfortable offering a new plan without a star rating and know that you're going to get good customer service with that plan. Medicare Advantage plans have federally standardized benefits, but your copays will differ by each plan. Also, networks are different. Hospitals, that's part of your networks. All of those, you got to look at everything. Make sure that you have coverage with your network, because if you have a small network, you're probably going to be going out of network to get service. Well, in that case, it would be better to have a PPO or a Medicare supplement. So just keep that in mind. All of these things I can help you with. Okay. And remember, I do have that link for those free videos at the end of this, so you can look at it. I mean, just watch them at your leisure at home and everything if you want to know some more about this. So this is what you're looking for. You want to make sure your physicians are in the network. You want to identify the hospitals. You want to prescriptions, because most of these Medicare Advantage plans do include your prescription cost. So you want to find the most matches for a Medicare Advantage plan. You need to compare all the benefits. Make sure that you stay in network, all of those things, so it will lower your costs. Because remember, a Medicare Advantage plan is a pay-as-you-go. So the more you use it, the more it's going to cost you. And you can get surprise billings on Medicare Advantage plan if you need to use it. If you're very healthy, then you'll save more money with Medicare Advantage plan if you're very healthy than you would with Medicare Supplement, because that Medicare Supplement premium is going to be every month. Let's look at some costs for Part C. And, oh yeah, remember, Medicare Advantage is Part C of Medicare. Here are some of the just basic premiums on plans where they range from. Your premiums can be from $0 to $188. Now this is a little bit outdated. This slide I've got is it's probably about 5 years old or so. So these premiums have gone up a little bit, but it gives you an idea of what you're looking at. Maximum out-of-pocket expense can be anywhere from $3,000 to $6,700. Now, if you have a PPO and you go out of network, that can jump up to $10,000, $11,000. Hospital stay, normally it's a 5-day stay with the copays. Some of them have a copay up to 7 days. Your copay per day is somewhere, probably the average is around $300 a day, some a little less, some a little more. Doctors, this is your primary. A lot of them are zero. You can pay up to 25. Specialist, I have seen some plans $25 up to $65. Labs, that's pretty common. Diagnostics, 0 to 20%. X-ray 0 to 250. Those are just ballpark numbers, but it just kind of gives you an idea of what you're doing. Is you're paying copays every time you go see the doctor or you're in the hospital. You're going to pay a copay with a Medicare Advantage plan. And remember, you have those commercials on TV. They start talking about having Part C, and they don't really tell you anymore that that is Medicare Advantage plan. They want it to seem like it is like original Medicare, when Part C it's something that insurance companies offer. Like you have Aetna, United Healthcare, Humana, those plans. Those are some of the big ones. WellCare, any of those. So they actually pay the bills. So once you go into a Medicare Advantage plan, a lot of people say, well, how do they cover my cost? Well, the way it works is Centers, Medicare, and Medicaid pay the insurance companies every month for every member they have on that plan. So when you go to the hospital or the doctor or the pharmacy, because most of them have your drugs included in there, then you'll give them your Medicare Advantage card, and you won't have to give them your original Medicare card, just your Medicare Advantage card to cover the cost. Okay, so let's look at this next one. We're gonna tee this up, do a comparison between Medicare Advantage and Medicare supplements. So here's what we're gonna look at: Medicare supplement versus a Medicare Advantage. Now we're looking at a Plan G for the Medicare supplement. With a Medicare Advantage, remember, they're either an HMO, PPO. There are some HMO POS, that's point of service. There's very few now with the PFFS, that's private fee for service. Those are very they're becoming extinct actually, and those are mostly in the rural area. They are becoming obsolete. So remember, Medicare supplements do not have networks. Medicare Advantage has a network. Medicare supplements, there's no copays, but there is a premium each month. For Medicare Advantage, there are copays for each individual service that you're using. Part B deductible, $257. There's no deductible for a Medicare Advantage plan, but you do have copays. No out-of-pocket cost other than your premium and your deductible. On a Medicare Advantage plan, there is out-of-pocket cost, and it goes to that maximum out-of-pocket, which could range anywhere from $3,000 to $6,700. That is a little bit higher now. Once you hit that maximum out-of-pocket expense for the year, then the plan will pay 100% for the rest of the year for you on your Part A and Part B coverage. Let's look at the next one. Now, with a Medicare supplement, you're going to need a drug plan. With Medicare Advantage, it's probably already included. So a Medicare drug plan, you're going to have an additional premium with that. So let's look at this. This is the popular reasons for either of these. Most popular reason for the Medicare supplement: freedom of choice. You don't have networks. You can use any doctor, hospital in the United States if they accept Medicare. There's no copays. There's no referrals required. So also you have a lot less headaches with the billing, because once you pay, if you have a plan G, what we're looking at here, once you paid that $257 and you pay your monthly premium, anything that's billed to Medicare that Medicare covers, the balance is going to be paid after you paid your Part B deductible. So it's not as much headaches, not billing issues. Medicare Advantage, they may decline claims. If you're not using it, it doesn't cost you anything. That's a plus. They do have those networks. Most popular reason to have one is the low to zero monthly premium. Now you still have to pay your Part B premium for both of these. And that's at $185. Both of these, you still have to pay that. Medicare Advantage, a lot of them don't have an additional premium. You do have doctors, you got to have the doctors that are in the network. You have the prescription benefit that you usually don't have a premium for. That's included. And it's simple to use because you only have one card to go take to the doctor, the hospital, and the pharmacy. Let's look at the cost. We're going to compare them here. Part B, both of them have cost on that, $185. A Medigap plan, average, now $140. That's going to be pretty close depending on if you're male or female. Female is probably going to be a little bit less. Medicare Advantage plan doesn't have that cost for each month. Some of them have a little bit of cost, but a little bit of a premium, but there are a lot of zero premium plans out there. Now, since last year, since Medicare was cut, we are seeing a little bit more on the premium side on the Medicare Advantage. So they're supposed to be cutting Medicare again for 2026. So we'll see what the new plans look like probably around September. And we'll know what's going to happen for 2026. And I expect that either they're going to have some premiums like $20, $25, somewhere in there, or they're going to cut back on some of the extra benefits that they're famous for giving. You've seen all those commercials on TV where you get all these other benefits like dental, vision, hearing, and food cards and all that. Well, most of those benefits that they're advertising are for people who qualify for what's called Medicare Medicaid plan, which is a special needs plan. And they're a little misleading on them because most people, if you don't qualify for Medicaid, you don't qualify for those plans. Part D, you have a premium on that. It's about $30. You don't normally have to pay anything for Part D premium on your Medicare Advantage plan. So here's the totals. If you don't use either one of them, this is what you spend. Medicare supplement plus your Part B premium and your drug plan, it's going to be somewhere around $355 a month. On a Medicare Advantage plan, you pay your $185 for Part B. If you don't use it, it doesn't cost you anything else. But every time you go and use it, it's going to cost you a premium, a copay. You go to the specialist, you're going to be paying probably $35, $45, something like that on specialist. If you're admitted in the hospital, you're going to have a copay for each day that you're in the hospital. So that's a little misleading. That's just letting you know that's what it's going to cost if you don't use it. But once you use it, then it's going to cost you more money. And on both of them, you're going to have the cost of your medications. Now, the good thing is now you're capped out at $2,000 this year. You won't pay any more than $2,000 for your drugs. They put a cap on it. That was a good thing that happened for 2025. Okay, let's go. We're going to talk a little bit about the drugs. And I just mentioned this a minute ago. The stages for the drugs for last year, you had 4 stages. You had the deductible stage, you had the initial coverage, the gap stage, catastrophic stage. And you could have been out of pocket, a lot of money if you used a lot of medications. This year from 25, the maximum cost is $2,000. If you take a lot of medications and you spent $2,000, then you go to the next stage, which is catastrophic, and your drugs are going to be paid for the rest of the year. You won't have to pay more than $2,000. That is an awesome benefit for this year. I know lots of people that pay thousands and thousands of dollars on their medications because they are taking like cancer drugs or something like that. So the good thing is you're not going to pay any more than $2,000 on your drugs now. You can pay less and be moved to the catastrophic stage because, like an example, Ozempic, they give us an example of that. That's $1,000 drug. And on the standard model for CMS, Centers Medicare Medicaid, they suggested that the deductible or copay on that was 25%, which is $250. Well, I know one company that puts that in tier 3, and it's a $47 copay. And what you are credited is the higher amount. So if CMS says you should have paid $250 and you only paid $47, well, the $250 is going to get credited to your maximum cost. So you're only out $47, but you're credited $250. That gets you to that $2,000 quicker. So you could max it out and have quite a bit less than the $2,000. It could be somewhere. I've seen some that was this last year, they only had to pay like 14 something. And the good thing is they come up with what they call the M3P. It's the Medicare Prescription Payment Plan. That's what that M3P stands for. And that's offered by the company that you have your Medicare Advantage with or your drug plan with. That's offered through them, and you pay the insurance company instead of the pharmacy. And what they do is they spread that out over 12 months. So you're not hit with all of that cover or that cost in the first 2 or 3 months before you max it out. So it stretches it out over the 12 months, which is a good thing because that way it doesn't put a big burden on you at the first 2 or 3 months of the year. But you have to apply for it through the insurance company to get that. And then you have to let the pharmacy know. That way they don't try to charge you at the pharmacy because the pharmacy is going to get paid by the insurance company. Okay. Here is IRMA. This is your premium on your drug plans. These are still, if your standard premium is whatever that premium is for that plan that insurance company is charging. And here's your income levels. Now, if you're over these income levels, that's what IRMA is. It's a income related monthly adjusted amount. You add on that amount if you're in those income areas. Okay. Oh, and the base premium, that's what Centers Medicare and Medicaid, they determined the base premium is $36.78. If you do have to pay a penalty for your Part D, it's your Part D penalty is calculated by taking 1% of that premium, the $36.78, which would be 37 cents. And you multiply that by every month that you did not have a drug plan to come up with what your penalty is. And that penalty is from then on. Here is the website, medicare.gov, 1-800-Medicare, for you to be able to enroll into Medicare. Just kind of remind you of that. And here is my contact information. And like I said, I would give you a link for the link to the website to get those free videos. It's https://medicare.empowerseniors.insure. And there are 5 different videos. It covers what I've covered here as well. Now, this webinar that I've been talking about. This is all of the information, or the copays and the premiums, the well, the premiums, the copays, and the deductibles. All of that is current information. I know that in those videos, those were done last year, so some of those have 2004 copays and deductibles and premiums in it. So just, but it does cover the basic information. And I did update the drugs because of this year, so that is a new video on the drug plans, and it talks about the prescription payment plan, Medicare. So I appreciate you showing up, and hopefully my assistant was able to help you with answering all your questions that you have. And if you just want help with it, I'm here to do that. You can call me. You can also email me, mike@empowerseniors.insure. I look forward to seeing with you and seeing if we can work together, and I can help you out. So thank you. I appreciate it. And I'll give you just a moment. You might want to take a picture of this slide. Okay. I appreciate it. Thank you.